Hi everyone, today we'll be talking about different types of neuroimaging. So what is neuroimaging? Well, we want to be able to see into human brains without having to cut them open. Scientists have been able to develop many different ways of examining both the structure of your brain and the function in live brains. We can examine structures to detect diseases like tumors or Alzheimer's disease, or we can detect brain damage from accidents or trauma. Here's an image of a brain scan. Do you know what type of scan this image is? Hopefully by the end of this lesson, you'll know where it comes from. Today, we'll discuss three main modalities or methods of neurological imaging: electric signal, magnetic signal, and radiation. So when neurons fire, we can detect their electrical impulses. We can use instruments called electrodes to measure neural activity. The first type of electric signal imaging we'll talk about is EEG, or the electroencephalogram. EEGs use electrodes that are attached to the scalp, so they detect neural activity from large regions of the brain and not specific neurons. Because EEG detects generalized brain activity, we can measure how alert or awake people are overall. For example, if you wear these electrodes when you go to bed, we'd be able to tell how deep you're sleeping. As you can see in this image, we can see unique brain waves for all four different stages of sleep, along with when you're awake. An EEG could even show us if you're feeling drowsy. Because we're just putting electrodes on your scalp, EEG is very non-invasive. Unfortunately, since these electrodes can't single out exactly which neurons are firing, we get very poor spatial resolution. Also, the signal is small because we're trying to catch the electrical signal all the way through your skull and scalp. Our second imaging technique that measures electrical signal is called ECOG, or electrocorticography. These also use electrodes, except this time they're placed directly on the brain. That means we have to cut open the skull, making this much more invasive than EEG, where we just place the electrodes on the scalp. In fact, ECOG is only used in dire situations, such as when patients with severe epilepsy need part of their brain removed. This time, some pros are that ECOG directly measures neural activity because we're putting the electrodes directly on top of the brain. We also get good temporal and spatial resolution, meaning that we get very accurate timing and a good idea of which neurons are firing. This also helps us locate lesions or regions of brain damage more accurately. One con is that ECOG is very invasive since we actually have to cut open the skull. ECOG is also only used for patients with epilepsy or other pre-surgery planning. We know that neurons use electric signals to communicate. However, when an electric signal is generated, so is a magnetic signal. This is why light is called electromagnetic radiation, and this also gives us a second way to measure neural activity in the brain. First, we have MEG, or magnetoencephalography. This is just like EEG, but it measures the magnetic field generated by neural activity rather than the electrical signal itself. And this also uses electrodes placed on the brain. We can use MEG mostly for pre-surgical evaluation, just like ECOG. So patients with epilepsy or brain tumors who may need surgery will use MEG to evaluate which parts of the brain are firing abnormally or too much, and this information can be used for the surgeon to decide which parts of the brain to cut out. Because magnetic field doesn't receive interference from tissues, we get better localization, which means that we get a more accurate picture of where in the brain the magnetic signal is coming from. We also get good temporal resolution because we're directly measuring as the neurons fire. The con is the MEG is very expensive to do. Next, we have MRI. MRI uses magnetic fields and radio waves to produce images of different slices of the brain. A powerful magnet induces a magnetic field, and the protons in all of the atoms in your body align with the field. Then, radio waves are fired, and we can detect changes to the magnetic field once the radio waves hit these protons. MRI scans can help us visualize different cross-sections of the brain. This helps us localize or find lesions in the brain. Here's an example of a program that lets you scroll through all of the MRI cross-sections. This lets you view slices of the entire brain from 3 different planes. This would be extremely useful to find which parts of the brain are damaged, and these lesions can show up as holes or dark spots on the scan. So here it is. So here we're looking at BrainBox, which is a website that allows us to examine different CT scans. So here we're taking a look at the sagittal scan, which looks at a side-on view of the brain. So as we take the slider here, we can actually look at all the different cross-sections that a CT scan has taken of this person. We can go left to right, and we can see different structures of the brain as we're navigating the CT scan. For example, we can see the cerebellum, and we can even see the corpus callosum. We can also look at the coronal view of the brain, which is a front-back view of the brain. So here at the bottom, the cerebellum is really pronounced, and we can see the cortex above. And we can use the slider to go back and forth and look at all the different cross-sections that the CT scan has taken of this person. Lastly, the third plane is the axial plane. The axial plane is a top-down view of the brain. So when we scroll, we can actually look at the brain from top to bottom. So here's just all the lobes, and now we're entering the corpus callosum. And once we go further down, we can get a clearer picture of the person's cerebellum and eventually the brainstem. Next is fMRI, or functional magnetic resonance imaging. fMRI was actually the first way to measure real brain activity in a live person. fMRI measures Bose signal, which stands for blood oxygen level dependent signal. So in your blood, oxygen is stored in hemoglobin, and this is actually what gives blood its red color. When neurons fire, they need more oxygen, so they increase their blood supply. The fMRI detects this as an increased Bose signal. fMRI gives us good spatial resolution because we can get a really good idea of what parts of the brain get increased blood flow. However, we get bad temporal resolution because it takes time for the blood flow to increase and the extra oxygen to be detected in the Bose signal. Thus, when a neuron fires, the Bose signal doesn't increase until about 4 seconds after the neuron fires. fMRI is extremely useful for finding out the functions of different brain regions. For example, we can do an fMRI of someone reading and analyze which parts of the brain are active during that task. In this image here, color represents increased neural activity. We can see that with different tasks, different areas of the brain light up, and this allows us to deduce different functions of different parts of the brain. Radiation can also be used to image the brain. Radiation gives off signal which we can also measure. For example, when we shoot X-rays to the brain, a sensor detects how much of the X-ray was absorbed by that part of the brain. This is how CT scans work. So CT scans use a really large circular machine so it can record these X-rays from all directions around your head. With an X-ray beam, computers can estimate how much of the X-ray was absorbed. Usually, the more dense a material is, the lighter the image appears on the screen. We can therefore use CT scans to quickly check for brain injuries, along with spine or other bone injuries. CT scans are very useful for diagnosing emergency conditions like a fractured skull. However, since it does use X-rays, you do get exposed to radiation, and people with metal implants would have those devices interfere with the X-ray imaging. Lastly, we have PET scans. These are positron emission tomography scans, and these use radioactive materials called radioisotopes. These are actually injected into the patient where they're metabolized or processed in the brain. In the brain, the radioisotopes emit positrons, which we detect as signal. When a part of the brain is active, its metabolism increases, so the signal would increase from that part of the brain. Thus, the radioisotopes localize to areas of higher brain activity. Because PET scans show us which parts of the brain are active and metabolizing, we can detect brain tumors, strokes, and other neuron-damaging diseases like Alzheimer's, which causes neurodegeneration. In early-stage Alzheimer's, we can actually use PET scans to analyze which parts of the brain are damaged before we can even detect changes in brain volume with CT or MRI scans. As we can see, PET scans are extremely useful for detecting changes in brain activity, giving us a better idea of changes in the brain than structural imaging could. However, like CT scans, PET scans expose the patient to radiation. We also get lower temporal resolution than fMRI scans, meaning that there's an even larger delay between when the neuron fires and when metabolism of the radioisotope increases. Here are all the types of neuroimaging you guys learned today. We learned how to look into the brain and how it functions with these 3 types of signal. Thank you guys for watching, and I hope you guys learned something today.